All right. Hello, everyone, and welcome. Do I see, is James Diosa still out there? If he is, where is James? James, come on up and join us if you like. You're a strong supporter of raising the rates, I know. I appreciate that very much. Look, I don't do a lot of rallies. That's not sort of, it's just not really in my DNA. But there are certain things that we know that if we don't fix them, it's going to harm all Rhode Islanders. And we're here today to talk about healthcare. If there's a healthcare worker in here who wants to come join us up here, you are welcome. This is about you. If we want to save healthcare in Rhode Island as we know it, or frankly as it should be, we have to fix primary care. We know what the problem is. We know why every month, every year, it's harder to find a primary care doctor. We know why that is. We know it because there's not enough. We know that the problem is that we don't have enough revenue coming into the system. The reimbursement rates in Rhode Island are too low. They're not only low in a vacuum, they're too low relative to our neighboring states. We know that there are only three ways that healthcare gets paid for. It's either by Medicaid, Medicare, or commercial. And we are lower in all three of those areas compared to our neighboring states. We know it. If someone asks you for the data, well, who do we ask? We ask my friends up here. Because all of the doctors and all of the senators and representatives, and thank you for being here with us, senators and representatives, they all know the answer to that. They don't need a study. They know the answer. They're here because they've chosen to be here, whether you're a doctor or another primary care provider. You're here because you choose to be here, notwithstanding the way we pay for healthcare in this country and in the state. And the way we pay for it and how we're paying for it hurts not only primary care, but hurts health systems generally. And when it hurts health systems generally, what that means is it's harder to build and maintain and pay fairly our healthcare workers. And make no mistake, no matter how much I love doctors, and I love one in particular, no matter how much I love doctors and primary care doctors, we know who it is who gets us through our darkest times in healthcare. And that's our healthcare workers. It's our nurses, our nurse assistants, our CNAs, and all the other healthcare workers, and the workers that keep our hospitals going. Our dietitians, people who work in the kitchen, in the cafeteria, the custodial staff, the linen staff. I can keep going, and I'm probably going to miss something. But it takes the whole healthcare family to keep us healthy and safe. And we're not doing enough to do that. We don't need to study it. We need to fix it. And I want to give great credit to the House and Senate for their advocacy in this space over the last 2 years. Both the Senate and the House have had bills in concept with concepts very similar to what we've proposed, and we have used some of those concepts for what we have proposed most recently. And I want to be clear, what we're here for today is not just about what the Attorney General's office has put in as concepts and bills. I believe in them deeply, and I know that they will fix our primary care problem, at least stabilize it for now. But we have a much broader problem, and it takes all of the healthcare legislation that's been introduced by the Senate and by the House, the chambers that have been such leaders in this space. I see Representative Bennett, who's arrived, a nurse, knows an awful lot about healthcare, has taught me a lot about healthcare. Thank you, Representative. So what we know, I'll tell you later, Representative. I love you. That should be enough. We know it takes more than what we're just talking about today. But what we are here to talk about today in particular is raising rates for primary care providers. You know, when we think about our primary care providers, you know, you can come up with all kinds of allergies as what they mean for us. But our primary care providers, doctors, advanced practitioners, what they are to me are the air traffic controllers of our healthcare. They see the whole patient, right? They know and understand all of our problems. They can see the pathways to fixing them. They're there to help us after we have been handed off by some of the great specialists that we work with, right? But we know that after you see the specialist, if there's follow-up, that comes back to your primary care provider. They are the air traffic controller of our healthcare. And what happens when air traffic control goes offline? Literally, the system crashes. And we've seen that tragically, really, in our aviation industry in the last several months. But the analogy is an apt one, I think. Because if we don't have the air traffic controllers, let's not believe for a minute that you're just going to hand off your care to a series of specialists and get the same kind of holistic medical home care that you get from primary care practitioners. That's not how it's going to work. The system will collapse. And so we have proposed, because of the emergencies that we have seen this session, targeted changes to how we pay for Medicaid. We're going to raise our Medicaid rates with the passage of this legislation to Medicare rates. And we believe, with our partners, that for the time being, will stabilize our primary care industry practices while we work on a broader, together with the House, Senate, work on a broader fix. But the time to study and the time to think is behind us. Now is the time to act. And we don't have a glide path. We don't have a glide path. We know from our own investigations that if you were to call an average commercial network today and try to find a physician that was taking patients, at least 18 months ago, I hope it's improved, but 51% weren't taking new patients in that insurer's network. That shows us what the problem is. You know, the canaries in the coal mine have died. And it's time to fix the mine, or get out of this mine and get back up on, well, my analogies don't always work. I don't know where it's going. That's the problem, not writing anything down. The bottom line is we can raise our rates. We know we can do it. We can find the money, right? Someone told me the fiscal note is $30 million. On a $14.2 billion budget, we can find $30 million to keep every single Rhode Islander safe with a primary care doctor that can manage their care. So, look, there are receptive voices in this building. They can carry this ball over the finish line. I see Thunder Mist is here. Thank you for the great work you do, and many, many other partners. So I'm going to step away, and I'm going to turn the microphone over to Dr. Kate DeClercq. Dr. Kate DeClercq is a family practice physician, exactly what we're talking about, and the Associate Medical Director at Thunder Mist Health Center. Dr. DeClercq.
Good afternoon, everyone. Thank you for that introduction. I'm Kate DeClercq. I am a family medicine doctor, and as the AG said, I work at Thunder Mist Health Center, and I am also the president-elect for the Rhode Island Academy of Family Physicians. So as you've heard here already today, primary care is in trouble. There are not enough primary care providers in Rhode Island, and practices are struggling to keep their doors open. We need over 250 more full-time primary care providers to adequately meet the needs of the population in Rhode Island. Think about that. And it will be a challenge to even maintain that status quo if practices like Anchor Medical continue to close and our neighboring states succeed in paying their primary care providers more, luring our providers across state lines. To that end, I want to extend a heartfelt thank you to the Attorney General and his team for the bold proposal that they put out last week. Primary care is in an unstable place, and so many of us are profoundly disheartened by the lack of response to the crisis. However, reading the AG's proposal was the first time in many months that something really gave me a feeling of hope. Corporate profiteering and underinvestment in primary care is deeply embedded in our healthcare system. And only through bold and decisive action like the proposals made by the AG's office will we be able to right the ship and stabilize primary care. So let's talk about the thing that brought us all together today, Medicaid rates. I work at Thunder Miss Health Center, and I imagine most of you are aware that we experienced a series of financial challenges over the summer that led to a number of layoffs. We lost nurses, medical assistants, community health workers, members of the social work team, the practice management team, our prior auth team, to name a few. The work that had been done by those people got shifted onto those of us who remained, which has meant increased stress on already stressed out teams, longer wait times for processing things like prior authorization, and loss of vital services. I, for example, can't do what an addiction peer recovery specialist does. A major reason for Thunder Mist's financial difficulties, and those of many other health centers here in Rhode Island, was Medicaid reimbursement rates. 55% of health center patients are on Medicaid, and Medicaid reimbursement rates at our health center only cover 85% of the cost of care. So this isn't about anyone trying to get rich. This is about covering the cost of care. This is about being able to deliver high quality, coordinated care. This is about fair and competitive pay. This is about retaining skilled and experienced employees.
This is the Rhode Island Capitol Police. Made the Pepsi driver. The Pepsi driver, come and move your van. I repeat, they have your attention. This is Rhode Island Capitol Police. The Pepsi driver, your pockets, your van in the upper lot, taking up somebody's space. Please come and remove your vehicle. You have 5 minutes.
Oh God.
Grab a Pepsi.
Yeah. So this is about fair and competitive pay. This is about retaining skilled and experienced employees. This is about preventing burnout for overworked teams. And this is ultimately about saving our primary care practices so that everyone in the state can have access to primary care. So let's raise the
Thank you, doctors. Great to hear from doctors who are doing the work on the ground. Next, I want to introduce my friend Lynn Blaze. She's the president of the United Nurses and Allied Professionals, UNAP, Local 5110, and is a nurse at Fatima Hospital. And she'll tell you for how long. It's a good long time.
Too long.
Lynn.
Hello, thank you. I want to thank the Attorney General, his staff, and his staff for sounding the alarm and coming up with an action plan to address the healthcare crisis here in Rhode Island. I have been a registered nurse for 41 years. I know I don't look it, but I have. Spent all of my career in the St. Joseph's Healthcare Service Department, currently as a recovery nurse at Fatima Hospital. I also represent over 6,000 healthcare workers here in the state of Rhode Island who are proud members of the UNAP. We see a healthcare system in critical condition and quickly running out of time before it implodes. We have 2 of our hospitals on the verge of closing. We have extensive wait times in our emergency rooms for treatment, patients waiting days in the ER because we don't have inpatient beds, patients waiting weeks to get ordered tests and exams scheduled, patients not getting the care they deserve because our healthcare workers and physicians are crossing the state line for better pay and benefits in Connecticut and Massachusetts. This legislation is the first step to help repair the state's failing healthcare system. As a nurse, I have seen many patients in our ER seeking treatments for issues that could be treated by a primary care doctor, but they don't have one or can't get an appointment. Our beds are overflowing with patients suffering from complications of chronic conditions that they couldn't find a primary care doctor to treat them. Those with high blood pressure are now in hospitals because they've had a stroke. Those that have high cholesterol without treatment are now in my hospitals because they've had heart attacks. Those with asthma who can't receive treatments are now in ICUs on ventilators. Those with diabetes are now suffering from nerve damage, vision issues, kidney issues, amputation of limbs from infection and poor circulation, or being diagnosed with late-stage cancer because you don't have a doctor doing regular exams and screening tests. Those are just a few of the examples of how broken the healthcare system is. If we can start somewhere, this is a great place to start. I don't want to hear it from a patient that they tried to get to a doctor, but nobody will take them. I don't want to hear from a patient that I got an appointment, but it's a year from now. I want to know when I discharge my patient from the hospital, we can get them a follow-up appointment with a primary care doctor. We don't need any more studies or commissions to look at the problem. We know what that problem is. We can't recruit or retain good primary care physicians without changing the reimbursement rates. Every Rhode Islander deserves a doctor, and this legislation is a good start to get there. And then we can continue to move forward and start to address the other issues that are killing the healthcare in Rhode Island. So thank you, Attorney General, for setting a pathway forward, giving me hope that we do have a future in healthcare here in Rhode Island. Thank you.
Okay, next I want to introduce Dr. Beth Cronin, who has stood with us before. She is the Division Director of the Division of General Obstetrics and Gynecology at Women and Infants Hospital. Doctor?
Good afternoon, everyone. I'm here in my role as the Rhode Island Section Chair for the American College of OBGYNs. I have a little different perspective to share with all of you on the primary care crisis here in Rhode Island, as I'm not necessarily a direct primary care provider, but my friends, my colleagues, my patients are so impacted by the current challenges of this primary care crisis in Rhode Island. I'm incredibly grateful to the strong support that the General Assembly has shown over the past few years to examine this crisis and to do the things we need to do. And this proposal by the Attorney General to increase Medicaid payment rates to better support our primary care colleagues is crucial to sustaining our primary care practices, access to health care, and ultimately the health of all Rhode Islanders. Currently, the primary care reimbursement rates do not cover the cost of actually providing the care that happens in the office. We need this high-quality care to remain available for everyone. As OBGYNs, we gain a unique perspective into what happens when patients actually access regular health care. Many people, when they are pregnant, say, oh, I will find a doctor, I need to go and get care, whereas I'm guessing many people in this room haven't necessarily been to their primary care doctor in the last year, thinking, well, I'll get there when I get there. But in pregnancy, we see many patients who either didn't have insurance, but now have access to insurance and are coming in for care, or realized, now I need to get this routine care. During the course of a 9-month pregnancy, in the course of the prenatal care appointments, patients come in, they come to our offices to ensure they'll have a healthy pregnancy. They receive their necessary labs, vaccinations, ultrasounds, and consultations to help lead to a healthy birth for themselves and their baby. During the course of pregnancy, we often uncover previously unknown medical conditions that may put one's long-term health at risk. This includes hypertension, diabetes, depression, thyroid disorders, just to name a few. As OBGYNs, we often manage these conditions during their pregnancy, but our expertise truly ends in the postpartum period. At this point, we want to hand them over and transition these patients back to their primary care clinician. And if they did not have a primary care physician prior to that, we need to identify one. This has become harder and harder over the past few years, with many offices, as you've heard, not being able to absorb the sheer volume of patients needing a primary care provider. This limited access is only going to get worse with the closure of Ankle Medical. We've heard about the layoffs at Providence Community Health Center and Thunder Mist. There's other future state-specific workforce limitations. We need to take action now. We need to improve reimbursements so that our primary care colleagues can keep their staff paid, their lights on, and their doors open. As mentioned, this isn't about the individual physician making more money. This is about keeping our system financially feasible. If we don't, I have no idea where I'm going to send my patient who I just recently diagnosed with severe preeclampsia or hypertension of pregnancy, who now has an increased risk of future cardiovascular disease, and she's going to need ongoing management to reduce her lifelong health risks. We know that 2 of the leading causes of death in the first year postpartum are cardiomyopathy and mental health conditions, both of which have significantly better outcomes if patients have access to continuous, comprehensive, and affordable health care. Without access to primary care, our patients will suffer. Rhode Islanders will suffer. We need to do all we can to ensure that our primary care colleagues can practice sustainably and don't leave our state for jobs where they can be more fairly compensated so that all patients can access high-quality primary care right here in Rhode Island. Thank you.
Okay, and now, because he always brings, what better way to close than with someone who always brings the energy, and that is my friend Pat Crowley, the president of the Rhode Island AFL-CIO. He's a union organizer with over 25 years of service to the labor movement, which is public service. For sure, during that time, he's worked for the Teamsters, SCIU, and NEA Rhode Island. Pat?
Thank you, General. I'm the grandson of a nurse. I'm the son of a nurse. I'm the father of a nurse. I'm the nephew of nurses. I'm the cousin of nurses. I'm the uncle of nurses. I'm the friend of nurses. And I just happen to be the elected union leader for over 15,000 nurses and other allied professionals here in the state of Rhode Island. And I gotta tell you, my members are fed up. They're fed up with a system where the math doesn't math. They're fed up with having to go to work every day in a system that chronically is underfunded, that is treated as if it's an afterthought by this economy. And we need to change that, and we need to change it now. I'm sure a lot of the folks in this room know the numbers. There are 317,000 Rhode Islanders who are on Medicaid. Close to 250,000 Rhode Islanders who are on Medicare. Does anyone know who the third largest cohort of insured Rhode Islanders are?
The uninsured.
Union members. This third largest cohort of people with insurance in this state are union members, and my members are sick and tired of a system that raises their costs because the government doesn't spend enough on Medicaid and Medicare reimbursement. Now, I say that not to knock anyone on Medicaid and Medicare. I really don't. In a perfect world, you know, remember, I'm a trade unionist. We would have a single-payer healthcare system where no one is denied healthcare because of what they're fighting. But we all know that when Medicaid and Medicare rates are cut or lowered or held stagnant, that's really a hidden tax increase on the thousands of members that I represent. Let's call it what it is. It's a pass-through onto working-class Rhode Islanders, and we need to make sure that that type of system stops. Now, I'm here to say thank you to the Attorney General, his team, and all of our friends in government who are standing up here with us today. I'm also here to tell you that the labor movement is here to do our part. Now, we have 80,000 members across the state of Rhode Island, all of whom have good health insurance through their union. Imagine if we had 100,000. Imagine if we had 150. Imagine if there were 200,000 people with union-negotiated health insurance benefits. How much better this system would be. Because more people would have the power to hold those in power accountable for what is happening in this system. And by the way, if you're not in part of our union, talk to me afterwards. We'll make sure that you get that. But there's got to be a better way to do this system. Now, I think everyone in this room knows what's going on right now at Butler Hospital. And if you haven't had the chance to get down there to 345 Blackstone Boulevard, do it. Go talk to a frontline worker. Talk to one of the nurses, CNAs, technicians, and anyone else who knows what it's like to work in an environment that is chronically underfunded, that is treated as if it's second, third, fourth-class work, that is always scrambling for every dime, nickel, and penny to do the things that they know are important, that their patients need. It shouldn't be that way. Doesn't have to be that way, and we have the power to do it. Because I got to tell you, my members are sick and tired of working in an environment that makes them sick and tired. And we're going to see more of that. We're going to see more disruptions. We're going to see more picket lines. That's not a threat, it's a promise. Because our members are tired of it. I see all these folks in purple here in front of me from UNEP and from 1199 and SCIU. They know what it's like to work in a system that treats them as if they don't matter. And they know what it's like to work with patients in a system that doesn't treat them like they matter. But you know what? They do matter. And I'm calling on every single one of you here. Whether you have a title in front of your name or not, you have a part to play. And let's make sure that we start to set this state on a different course, and let's get these Medicaid rates up. Let's start treating healthcare like it matters, and let's make sure this system works for working class Rhode Islanders. Thank you.
See that? They wanted me to start with him, and I said, no, that's not how we're going to do it. I want to thank all of the Senate and House supporters, some of whom have been here today already. Some have checked in from elsewhere. I know that Representative Boylan and Donovan were here. We have the great Representative Cotter, who I've held signs with, but different signs that say Cotter. Senator Ujapisa is here. Senator Coyne has been a good colleague on this, as have been many, many others. Look, you know, it's about raising rates. It's about eliminating prior authorizations. These doctors don't need to tell me or you or all of us. They know how many hours they spend on prior authorizations that come through anyway, that just delays care, frustrates them and their staff. I read a study recently where 13 hours, according to the study, 13 hours a week are spent on prior authorizations. I suspect it's actually higher than that. But it is a waste of time that could be spent on patients. We need to raise these rates. We need to eliminate, we have a bill in to eliminate prior authorizations. The Senate has done some great work there already. That's the concept that we need to build on it. Pass, actually get through. You know, Pat put it really well. There are a lot of Rhode Islanders on Medicaid. They are, make no mistake, they are working Rhode Islanders. Yes. They're working. Not every business, in fact, many small businesses are not big enough to provide health care, or don't, or won't. We'll leave that for another day. But the reality is, many, many working Rhode Islanders are on Medicaid, and we've chosen, as a state, to give them health care. And that's the right decision, because it keeps costs down. And it's the right thing to do, but we have to pay for it. And when the rubric is this, I'm going to make this up for what the procedure is, but let's call it a physical. And you get $100 for that physical if you're a Medicare patient. And you get $200 for that physical if you're a Blue Cross or United patient. And you get $37 if you're a doctor for that Medicaid patient. You see the problem. We have chosen to ensure 300,000 plus working men and women and children in Rhode Island, but we have not made the commitment to pay for it. And as long as we refuse to pay for it, we won't get what they need and deserve, and we're going to continue to have these labor issues because of a lack of revenue in the system. The more money in the system, fair money in the system, makes it much easier, in my view, just speaking for myself, to resolve labor disputes. When the pie is small, it's harder for everybody. Patients, labor, healthcare workers, doctors. We know the fix. Let's just do it and move on to the next step. So thank you very much, everybody, for coming today. I really appreciate all of the healthcare workers, the physicians. You know, there's a lot of physicians today that would love to be here, but you know what they're doing? They're taking care of patients. So while they're taking care of patients, let's work for them. Thank you very much, everybody. And thank you to my team and my intern.